Dr. Daniel Hommes, unscripted.
Dr. Hommes, tell me your story.
There's some science stating that Dutch kids are the happiest kids in the world. I was definitely part of that. My dad was the veterinarian to the Dutch royal family. And so he used to take care of the royal pets. And when he would go on calls, guess who went with him? I remember these memories fondly, playing ping pong with the current king. And if I recollect, I did beat him at some point. I lost my mother when I was 4 to breast cancer. After the passing of my mother, it was basically my father and my 2 older brothers and me. As you can imagine, it is such an ordeal for a kid not growing up with a mom. You have this fantasy that she still looks down on you. And so that made me try to always put my best foot forward. Sports have always played a big role in my life. Really was very involved in the rowing. We really had an aim for the Olympics in Seoul in 1988. When we did not make it, I needed to radically shift from working out and training hours and hours a day towards finishing up medical school. In those days in the Netherlands, you would do 6 years of internal medicine and then 3 years of GI. And I did my Ph.D. before I started my specializations. So I had years and years of really deep focus in gut immunology. As many doctors do, they don't take care of themselves well. So when I turned 50, my wife told me, go get screened. So I remember going in for a checkup. I got the results. Being diagnosed with cancer myself at a relatively early age was quite the scare. It was not death that scared me at all. It was the fact that I would have to leave my wife and my kids being exposed to the same hardship that I went through in my years.
How did surviving cancer teach you about being on the other side of care?
Me becoming a patient after the cancer diagnosis was quite a revelation, to be honest. It gives you a very different look on the healthcare delivery and on the vulnerability, now being very dependent on other people and not in the know. That did a lot for me. Recently in Nature, there was an index published that reflected institution according to the highest scientific quality. And guess who was number 1? It was UT Southwestern. I was appointed Chief Innovation Officer May 1st, 2025. When I came to UT Southwestern, and obviously I was aware of the stellar science, but what I wasn't aware of, what the anatomy of campus looked like and how many investigators and inventors we actually had. We have 506 labs. I thought that really the ideal model that I needed to pursue was somehow to marry the academic expertise with the industrial speed and scale. The Innovation Hub makes our inventions here on campus real, it makes them known, and it makes them grown. What we're trying to solve for is to take all these great inventions that we have on campus and really help develop them, mature them on a pathway to truly impact the lives of patients. We anticipate that the Innovation Hub will be a catalyst for a new economy that needs to rise in Dallas.
Your wife is also a physician and your family is deeply rooted in health and movement. How has your family shaped your philosophy of wellness?
Exercise and nutrition are basically the key ingredients to a longer, happier life. And the good news is that is all in your control. My family is certainly my support system around that, all enjoying fitness. Married to Edith, 32 years. She was a rower as well, so we met in Amsterdam. My 3 children, they all played sports, college athletes. Isabel is the oldest, then we have Wander, and then Sabine is the youngest. I've competed in 2 full Ironmans. I think 5, 6 halves, and then marathons, 10 plus. If you think about a career as a 20-chapter book, Call me crazy, I think I'm writing my second chapter, so there's still a lot to come and look forward to.
Dr. Hommes, if you could share one piece of advice with your younger self at the start of your career, what would it be?
Don't waste time unnecessarily. You have total control over your decisions. If you feel that you need to move to a different path, pivot early and fast because it's so worthwhile.